Hello and welcome, dear learners, to the NIPTEL course on Healthcare Quality Management, Infection Control and Patient Safety. Today we will be discussing on the importance of quality in improving patient outcomes and healthcare system performance in Indian hospitals. We have discussed about the quality in Indian hospitals and taken a lot of examples with respect to how to develop the culture of quality in the hospital. In aligned to this, today we will be discussing about the training competencies, patient-centered care, leadership, and even economic benefits of quality. The Indian best practices in quality will be discussed over here. Training and competency is a need in hospitals. And what is competency management in hospitals? Do hospitals require competency? Yes. It ensures hospital staff have the skills, knowledge, behaviors, and qualification needed for their jobs. It uses ongoing training and evaluation to measure and improve staff skills. What does it really focuses on? It focuses on the areas in hospital, particularly to give credentialing, skill assessment, evaluating and monitoring, compliance monitoring. So if you have to take the credentialing, checking that staff has proper license and certification or not. It improves very important issues which are focused with the major problems that the quality faces with. Skill assessment, training staff and evaluating the skills regularly. It can be on job, in office, or even they can send for the training purposes. Evaluating and monitoring. Ongoing check of staff knowledge and practical abilities, which is very important for assessing what the current staff really needs about the advanced practices. Compliance monitoring. Ensuring staff meet regulatory standards. Benefits of competency management in hospitals. There are endless 5 competency benefits where it ensures regulatory compliance as first, where it tracks the credentials and hospital complaints. It helps avoid fines and penalties, where you find a lot of litigations which are there more because when your hospital or your healthcare institution doesn't ensure regulatory compliance. Improves staff efficiency and confidence, which allows your staff to make the workplace more better, more safer, and they can reduce or they can do very fewer mistakes. Increase the satisfaction and confidence them, where the employee satisfaction will also reflect the culture of safety, the culture of quality. So improving staff efficiency and confidence is a very important key which is being counted in competency management. Reduces legal and financial risk comes as a third, which is very important to lower the risk of lawsuits and errors, where you find most of the errors are more which are leading to lot of compensation. Lot of risk that the hospital has to face is more comes with this, and you have to take major role for your law team actually and consulting them how to reduce it. More like if you are developing the competency management, it is very important that your hospital can face lesser issues. Protects to save the hospital reputation. Nowadays hospitals are more concerned about their reputation, their image, which is built with long days of efforts and many people. But one small incident actually can reduce the entire gamut of the reputation, where the hospital should be more aware about. Then comes supports data-driven decision making, which is very important, where the hospital can show the gaps and staff needs, which is very important. With the help of the data, you can take all good decisions. All the decision making lies into the hands of the proper data collected, proper data saved, and the proper data that is utilized. Guiding training and improvements actually, which is also on the base of the data. And the decisions actually that we will take actually after seeing the training and improvements will result to a better health outcomes. Enhance patient outcomes, which is very important, where it comes as to see that fewer errors and better care, a proportion actually which results into the better care. Improves patient satisfaction and recovery, which is the ultimate and a major aim actually to prove that competency management leads into patient satisfaction and recovery. Training programs for patient safety. The need which has been given actually, that training emphasized actually on hospital environments to make it more safer, reducing the misunderstanding among the staff, and a strong patient safety culture which improves the healthcare quality, affects the health hospital performance, and even the productivity among the healthcare professionals. So training has major benefits and it reflects into the patient safety. Proper training helps reduce medical errors, it improves patient outcomes, and hospital operations gets very smoother. So there is this interconnectedness which comes with the help of training programs. What are the key focus areas that you should more train, and why training is so emphasized? Because it gives more emphasis on staff education, skill development. It is like you are investing on your staff. It is like you are updating and giving them lot of advancement actually for their skills. Secondly, it affects the effective communication among the healthcare teams. Your healthcare team will get more better healthcare communication. It is not only to betterly understand that the team should work with cohesion, intersectoral coordination, and cohesive decisions, but the major benefits lies to go understanding or dealing with the patients. The third focus area is medication safety, which already a physician knows that how a patient can be affected if there are errors in medication, from doses to giving, and even the cycles, or even understanding the name, and too many things which comes actually to give medication safety a major concern. Infection prevention and control, which needs to be a culture actually, which can be made with lot of efforts, that the team can be involved to work on infection prevention and control, where prevention comes first and control is where it leads actually to accumulate or even erase actually if though there is an infection in the hospital. And along with this, you should also be ready for all those unprecedented situations where the hospital can face of the emergency. So emergency preparedness also has a major stake for quality. And for all this, what do you really require? You require a strong team network, you require a clear communication, and essentially this all will result in what? It will result in safe patient care. Though there are some pending challenges there can be, yes, there can be a lot of pending challenges. There can be even an poor or weak organization culture which may affect or create more lot of hurdles for this. Patient safety remains a top priority in your hospital is one an issue which can be emphasized through training. Patient safety contributes to better health outcomes. Patient safety can increase higher trust and even lowers the cost. Continuous improvement and compliance with regulations. So all these are more connected with patient safety. So the hospital or healthcare organization should emphasize on giving more training on patient safety. Ongoing staff training strengthens the healthcare institutions, hospital systems, and it equips the staffs with the professional development that they require. The skills that ensures the safety culture, there should be a lot of collaboration and communication which can improve the patient safety. Now there is a discussion to be held on patient-centered care. So what is patient-centered care? It is only just to focus on the patient need? Is it just only to concentrate on the patient's disease condition? Along with this, there is a lot of things that the patient-centered care has. Patient-centered care focuses on the whole person. It is more towards the holistic care and just not the disease condition which a physician or a healthcare professional may see only by the physical structures. Each patient is unique. Each patient has its own value, preferences, goals, and likes and dislikes. So a healthcare provider should understand all this thing, which is more giving a direction to a patient-centered care. Patient-centered care is a care which considers medical, social, emotional, psychological, and even the spiritual needs of the patient. It's more a comprehensive approach towards the patient needs. It builds a culture actually of understanding or developing a trust, shared responsibilities between patient and healthcare providers. It improves continuity of care and primary care delivery. So the continuum that we are discussing of continuity of care will be more solved with this. Also, the primary health care or primary care delivery, which is very much a broken and a very important topic, the patient-centered care can also be emphasized. The current National Health Policy 2017 of our country emphasizes more on patient-centered care. It is also connected with the Bhore Committee's report actually, which emphasizes towards the patient-centered care. Patient-centered care encourages patient to participate actively in their own care, where you give more emphasis to the patient of understanding like how you are more into your own care. What does it really require to give a patient-centered care? It requires more clear communication, which is very essential actually to understand the patient concern. What really the patient or patient's relative really like for. What does it really require actually to practice it? It requires that there should be an empathy and a respect towards the patient, a dignity of care that a patient really needs. The dignity is not that the patient should really, the dignity should be own actually to the patient, and where you find that a patient first policy is very important to be developed in your healthcare professionals. Patients should be given information and tools to make decision about their care. They should be well assisted to understand what really the surgery that they will be going through, what sort of equipments actually they will be coming across to, what sort of diagnostics they will be going through, what of the supply of the medications really will affect their body. Everything for the patient's doubts actually need to be cleared actually, which is where you can say that is a patient-centered care. Practical experiences in the family medicine help students manage multiple conditions and apply person-centered care, where an individual person is very important to be taken in terms of the social, emotional, psychological and the spiritual needs of the patient, where they cannot be seen as a very marginalized into the healthcare system. Accommodating their faith, accommodating their religious beliefs are also very important to seen as a patient-centered care. Technology can support ongoing feedback, assessment and learning, which can really help actually to move towards a culture of patient-centered care, where it cannot be only taken that the patient's physical condition is where the healthcare worker should see, but it is more towards getting more like what the patient really needs. So your hospital should have a feedback system. Yes, it is. Is it like the hospital should work more on counseling? Yes. And is it like more towards getting more dignity? That is very, very important that the culture should be developed about. Shared decision making involves patient in their treatment choices, which is very important for those patients who are continuously seeking for their chronic conditions, or even patient like cancer, chronic renal failure, HIV patient, tuberculosis patient. They require a lot of decision making, which is very important that they should be involved into the care. Reduces unnecessary procedures and can even lower the cost of the treatment that the patients are more burdened with. The high out-of-pocket expenditure is more reduced because of only patient-centered care. The catastrophic health expenditure that the patients are, especially Indian patients, vulnerable patients, such as poor patients, those are one which are majorly affected, and if though the healthcare providers are taking this decision making with the patient, the catastrophic health expenditure can be reduced actually. How does a hospital leadership and governance plays a role? Do you think it is very important that the leadership can even give a great change actually for the quality or the patient safety? You might be even knowing that lot of top leaders, effective leaders can remarkably bring a change into the industry. The same is the problem actually for the healthcare industry, that if they have a good leader, it is essentially that you may find a great or a safe healthcare environment. It can even affect the moral of the hospital employee, that they can be more driven actually towards the culture of quality. Can a good leader help to motivate or even generate the culture? Yes, it is, or even given a continuum of care. So good leaders lead by example, that they have very value in of hard work actually. They can be setting an example. They can prioritize the mission of institution where over the personal interest, so that you are not working for yourself, but you are even giving back to the society. Leaders provide a clear vision that guides the organization and gives a sense of purpose. Without a clear vision or without a clear mission, actually, the leaders cannot really proceed to meet the purpose of the organization. Positive and collaborative leadership builds trust among the staff and makes them feel safe actually to the share concern. Where a transformational leadership is one a very implicable model actually for the leadership, which can really help to solve lot of issues of Indian hospitals. Leaders set priorities, leader direct resources, and it reflects into the important safety initiatives which a healthcare providers also should understand. The leaders can really affect the supportive environment, yes, and it really allows actually that a good leader take quick decision, effective actions to also protect the patient, and not only the patient but even the staff, because the staff also requires a sort of a safety when they are providing all this care. Do leaders foster? Yes, leaders foster a positive culture. They improve job satisfaction. They reduces burnout among doctors, nurses and all healthcare workforce. They decrease medical errors, and really it helps, and you can see the whole lot of strength of the patient safety culture is more affected with the help of the effective leadership. Effective leadership and accountability. How can this be connected? Open discussion about the performance as well as even the results and the processes which brings the accountability in discussion, like building an accountability, trust and patient involvement. So it is like making more accountability is one and very important facet that a leader should work on. Usually for clinical leadership, it is a very important lesson that trust and patient involvement gives you more chances of developing yourself for clinical leaderships. Transparency promotes patient-centered care. So you need to have a lot of transparency, which comes as a very important decision that a healthcare provider need to focus on. Shared decision making and understanding between providers and patient, which sometimes create a major hurdle actually to the patient care. Patient safety reporting system allows anonymous reporting. Sometimes a patient wants to report about a healthcare provider or sometimes about the system, which sometimes because of the fear the patient may not really give, and you may find that it affects really the reporting, and they really don't really report for. So what does it really affects? It affects the reporting system and people really fear for not giving the reporting. Likewise for the healthcare providers also, if though there are incidences that they have to put a report, actually they really don't show up to, and this really affects actually the reporting part, and so lot we find that lot of reporting is not there. So the issues of underreporting is majorly because of blame, because of identifying risk that they are not getting affected. So the leader should ensure to take care that reporting should be continuous. It should be encouraged actually, because your continuous quality improvement is more because of your proper reporting system. Learning from the near miss events, learning from the sentinel events, learning from the adverse event. Many times you may find a lot of human errors are there for all these reasons of errors. So you need to work on a culture which really gives them a learning from the error, rather not blaming or identifying or even saying that oh, this has affected my thing and I really don't want to work on that part. So trust with transparency, trust with accountability moves to give a safer culture of safe care. Patient engagement and ongoing improvements in patient safety and quality are being seen with the efforts of effective leader. Now see the economic benefits of quality, which is very interesting to understand, like how economic benefits of efficiency of improving quality is very much again. We need to emphasize more on the effective medical waste. Lot of a time healthcare institutions and hospitals are being seen that they are a dumping grounds actually. Lot of medical waste is there which needs that you need to work and emphasize more on saving the money for healthcare facilities. So quality has a major benefits actually to reduce the medical waste management. The working on the biomedical waste management, preparing the hospital a culture towards making a more better biomedical waste management systems, improving waste management, sorting them, disposable, and all those that requires major efforts is more because of the economic benefits that the hospital should emphasize, and this will result in quality. Recycling and waste to energy programs is more towards the sustainability part, but it also gives more income also. So there is also an economic benefit over here. And following regulatory standard which avoids costly fine. You may find a lot of fines might be put from corporation, might be put from the government, state government, or even central government, and sometimes it is like a punishment actually the hospital may get if they don't abide actually to the laws. Though we have little poorer approaches of following the health legislation and healthcare acts actually in our country, but if though your hospital is more facing litigation for this or even fine, with the help of working on the efficient waste management or working on the quality, there is a lot of benefits of getting this economy. Then the value based spending in healthcare. So is it like you need to think on spending a lot, focus on value of healthcare intervention, not just their cost. So then don't think of higher cost interventions. Okay, that can be really worth to give a significant healthcare benefits. So lower cost interventions are to be very much promoted. Must be useless if there is a little or no benefit. So sometimes lower cost interventions really don't work up, so you don't have to see that. But if you find a promising lower cost intervention, that can also be very supported, that if you really get it. So value based spending is healthcare is very important, rather not some one person or two persons decision that will affect actually the spending. The spending should reduce or eliminate care that has no benefit or may be harmful. So if you are investing on a thing actually which is really harmful, what is the benefit of that? Provide medical intervention that offer good value. So benefits that matches the cost is where you find the medical interventions to be very successful. Otherwise, it's a waste. Now come up with the Indian best practices in quality. Do we have some best lessons to be studied over here? Yes. AIMS, the All India Institute of Medical Sciences, and the hospitals that they have created actually are working and have developed the best practices in our country towards hospital infection control policies. And there are even many such private and corporate institutions that they have also worked as being given as a best practices in quality. I would like to more emphasize on AIMS which has a clear infection control policy and has been stated as one of the oldest policy, that is from 1973, that they have been updated regularly. So you can see lot of infection control policy which has been developed and it is available, and you can go and see that how they have developed actually those policies. We will be reciting more on the best practices in the entire course that we will be studying for this. They work on the risk factors for healthcare associated infections, where it is very important in quality that patient with low resistance to infection, patient who are more of high risk actually need to pay more importance actually to be monitored a lot actually. Contact with infected individuals actually. Even the healthcare professionals also need to take care of the contact. So there should be a culture of hand washing. The culture how to prevent or reduce the lower resistance to the infection. Invasive procedures or interventions are very important to be seen as very important, where lot of emphasis is more given on the interventions part that has to be given to take up actually the initiatives or of having a very safe and clear interventions. Improper use of antimicrobials. Antimicrobial resistance and stewardship will be discussed in the later classes, but just to use a proper antimicrobial or use a proper medicine is very important to reduce the risk of HAIs. Drug resistance microbes is very important, where we find the growing culture of tackling superbugs is very important and a growing problem. And contaminated environment, which is more with the practice of hygiene and sanitation. So lastly, counting the key components of infection control policy, monitoring HAIs, microbiological surveillance, investigating and managing outbreaks, and monitoring antimicrobial resistance. So your staff need to be trained towards the infection control practices, where you find the continuous education and training will pay more importance. It will also help actually to gain more economic benefits to the hospital. The health activities for the staff needs to be more encouraging, not only in terms of preparing policies or procedure, but even regularly updating them also. So NCAS initiatives, which was launched by Ministry of Health and Family Welfare, is what we have already discussed, and we identified that the support is more with the help of NHM, National Health Mission, which is focusing more on district hospital, sub-centers, PHCs, and even urban PHCs, and are based on all the global best practices that are studied across the world. They emphasize more on the 8 areas of concern, that is service provision, patient rights, inputs, support services, clinical care, infection control, quality management, and outcome. So NQAS certified International Society for Quality in Healthcare, and certification meets global standards. Incentives are given as listed, are very benefiting and promoting towards the service delivery part. So in summarization, I can say quality is in healthcare is very important. It affects how safe patient care, how much they trust the system, and how they allow the recover. A healthcare system that focuses on quality gives right treatment at right time with the least risk and most benefit. So good quality healthcare improves the patient faster with fewer problems and stay out of hospital after the treatment. In India, quality is even more important because hospitals have many patient loads, and very fewer resources, and different standard at different places. So by using all these best practices in clinical audit, infection control, digital tools, and regular staff training, we can achieve actually to reduce the mistakes, work more better, and earn patient trust. So lastly, I can say quality is not extra. It is necessary to improve India's healthcare system, make more fair for everyone, and get ready for the future health problems to be improved. I am giving these references for to go in detail for the chapter 3 to chapter 6, where you can see all the enlisted reference can help you to better more understand and go deep into the understanding of healthcare quality. Yeah, thank you for your patient listening. Thank you very much.